The risk factors for heart disease are pretty well known: smoking, a poor diet, and not exercising. But what is the county doing to make sure residents avoid those pitfalls? On this episode of Healthy Living, we will discuss how the county is helping people improve their heart health. That's next on Healthy Living. Welcome to Healthy Living. I'm Priscilla Ortega. One of Fulton's strategic goals is to make sure all people are healthy. So Healthy Living will always take a look at how the county is helping residents to do just that. The focus in this edition, Heart Health. The Partnerships to Improve Community Health, or PITCH, is one of the county's programs that is geared towards helping residents live better lives by eating healthier, exercising, and not smoking. First, we will discuss smoking. According to the Georgia Department of Public Health, the adult smoking rate in Fulton County is 16%, and 38% of adults are exposed to secondhand smoke. Joining me today to talk about what the county is doing to change those statistics is the PITCH Program Administrator, Lisa Gooden. Welcome to Healthy Living.
Thank you for having us.
So every February, the nation remembers American Heart Health Month, but Fulton County offers heart health services year-round. Talk about what are some of those services.
Sure. So obviously a big focal point of our health department is to work to make all people healthy. We feel that a healthy heart is very important, and we are working to provide blood pressure checks, cholesterol checks, and those services are available at all of our health department locations as part of the services that the health department offers. In terms of the PITCH program, we have 3 focal areas: increasing tobacco smoke-free environments, increasing environments for more healthy nutrition, and increasing physical activity. All 3 of those areas help to contribute to a healthy heart and to help reduce chronic disease.
So obviously heart disease prevention is one of the main goals for the PITCH program.
Yes, it is. Our main goal is to reduce health disparities in the most disparate communities across Fulton County, and to reduce the incidence of chronic disease among residents in our county.
And it's not just adults that you care about, it's also children. What are you doing for children's heart health, and particularly with when they get involved in PE activities?
Sure. So we have a really great, robust partnership with the Atlanta Regional Commission, and we are working with partners at Atlanta Regional Commission to work with our school systems in the Fulton County School District as well as Atlanta Public School District. We want students to be active at least 60 minutes per day, because that is what's recommended.
And in order for kids to want to be active for 60 minutes, you got to make it fun, right?
Yes, you have to make it fun. And 2 of the curriculum that we are offering are called EPIC and Spark. And those are very dynamic curricula that increases movement for everybody. So you don't have people standing in static play. People are actually constantly moving and interacting with each other throughout the activities.
Yeah, I saw some of the video. It's like a team effort to
Yes.
make sure everybody's involved. Okay. So what about before kids go to school? What about the little preschoolers? You're also helping with that too.
We are, and we know the research shows that when you start with children at an early age and they adopt healthy practices as children, they're more likely to have healthy practices as an adult. And so we are working with our early care and education providers in an effort to increase wellness policies at those centers where they are incorporating healthy eating, the selection of healthy foods, and increasing physical activity with those, not only the children, but also the teachers and the parents.
Yeah, everyone can learn a little bit.
Absolutely.
Okay, so let's switch gears and talk about smoking. That's also another risk factor. Now, as we mentioned, 16% of adults in the county smoke. So how is the Pitch program helping adults with that issue?
Sure. So in the area of tobacco, we're creating tobacco-free living, smoke-free living environments throughout Fulton County. We are working with our bar and restaurant owners to help educate them about the dangers of secondhand smoke so that they would be willing to voluntarily adopt smoke-free policies that would make it healthier for their patrons. We have also worked with the community groups, particularly the Heart Coalition and the HPAC Coalition, to work with our commissioners to pass the ordinance, which we know we just recently passed the no smoking ordinance in Parks and Recreation. So through that passage of the ordinance, some 125,000 residents are being impacted and can breathe cleaner air because we have smoke-free environments in those park and recreation facilities.
Well, yeah, thank you for that. And so no smoking in parks, you know, inside or outside.
Absolutely.
And you said there was about how many restaurants to date have you helped switch over from smoking to non-smoking?
To date, and the count is growing, but we have been able to work with 38 business owners to establish smoke-free policies.
And I saw some video with that, you know, the employees are happier, they're getting great feedback, so it seems to be all around good program.
And as part of that whole campaign, we've launched the Proud to Be Smoke-Free Fulton. So people will see that particular signage, or what we call klingons, go up into these restaurant areas. So you can walk in a restaurant and in the window they will display that they're proud to be smoke-free Fulton. So we're extremely excited to be helping the county move to a healthier place.
Yeah, and that'll definitely spread the message.
Yes.
So it's not just smokers, but also secondhand smoke that is also, you know, important for people to be aware of. And 38% of adults in the county are exposed to secondhand smoke. So how are you helping in that area also?
Sure. So early on with Pitch, we partner with Georgia State University School of Public Health, who has helped us collect data throughout the county that shows how dangerous secondhand smoke is. We also, through this partnership with Georgia State, surveyed over 960 residents who said it was important for them to have smoke-free environments and to breathe clean air. We also conducted what we call air quality assessments in the bars and restaurants to measure the level, a dangerous level of smoking, air quality in these bars and restaurants. And so all of that data shows us the importance of addressing smoke-free environments and addressing secondhand smoke.
And now you want to move on to multi-family housing,
We do.
right?
Yes, we are in the process of launching a pretty aggressive campaign to help owners of properties.
Like apartments,
Apartment
so just because they're not
complexes,
smoking, their
multi-unit
neighbors
housing.
might.
Yeah, the neighbors might too, have them adopt smoke-free policies that would increase the air quality in apartment living.
Okay, great. So if people want more information about the program, how can they get in touch with you?
Sure. They can contact us on our Fulton County website. They also can call my office at 404-613-1338.
All right. Well, thank you so much. This is great
Thank you.
information. So coming up after the break, I will be joined by a faith leader who will discuss how Pitch and the faith-based community are helping congregations live healthier. Stay with us. Welcome back to Healthy Living. I'm Priscilla Ortega. The focus in this edition is heart health. This segment, we will be talking about the Pitch program's Interfaith Coalition, which helps faith-based communities live healthier lives. Joining me now is Physical Activity Coordinator for the Pitch program, Joaquina Hamblin, and Reverend Conitris Houston, pastor of Trinity AME Church. Welcome to the Healthy Living Show.
Thank you. Thank you for having us.
And I'm glad you got the memo for all of us to wear red for heart health. So let's talk about what the goal of the Interfaith Initiative is.
Well, first off, we chose the interfaith community because they have their hands on the pulse of the community. In their organizations, they have the captive audience every Sunday, every Wednesday, every Saturday to the population that we are serving. So in our Interfaith Active Living Initiative, we are working to engage those houses of worship with adopting a model resolution that adopts active lifestyles. So active lifestyles encompasses everything from physical activity, smoke and tobacco-free awareness campaigns, walking groups, and corporate nutrition.
And about how many houses of worship are you working with?
In 2016, we were successful in that we engaged 26 houses of worship for a population reach of over 22,000. And this year, our focus is engaging 11 additional houses of worship for a reach of over 11,000. Currently, we're at 9.
So, Reverend, you are one of those houses of worship. Did you start in 2016?
Yes, we began our partnership with Pitch in 2016.
And what sort of programs are you incorporating in yours?
We are excited to be involved heavily in Pitch, not just with Trinity Church, but with our Early Learning Center. And so we have walking groups. We have one of our members who's actually currently in a training program with Pitch, getting aerobics instruction training so that she will be able to do aerobics sessions at our church. And also with our Early Learning Center, we're working with Pitch to do healthy eating, to promote more active lifestyle within our children's lives, and also incorporating that in the curriculum that we teach in the Early Learning Center.
So why was congregations and houses of worship, why was that a good place to spread the message?
Just because within the community, our houses of worship have always been just the center, the city center almost in their communities. So not only do they have their own communities for implementing programs, awareness campaigns, and just creating healthier or creating spiritually healthy congregations, but they also work outside of their four walls into the community. And with this being a population-based program, we wanted to be able to capture that with our efforts.
So there's walking programs. Talk a little bit more about the aerobics instruction.
Yes, so we do a lot of capacity building with our houses of worship, and in our capacity building efforts, we've offered AFA certifications. Those are for group instructors to provide safe training with their houses of worship and beyond. We have also provided trainings for diabetes peer educators, trainings for nutrition awareness or nutrition campaigns, and a number of services that we've provided, CPR AED, just a number of capacity building opportunities.
And Reverend, one of those areas you said you were also getting your daycares involved.
Absolutely. Absolutely. We just believe in whole healthy life, holistic healthy living. And so we're not focused at Trinity just on the church. We're not focused at Trinity just on the spiritual well-being of the individual, but we're focused on the church, our Early Learning Center, because if we can target our children, then we raise healthier adults. And so we are focusing in the Early Learning Center and allowing that to help give a foundation for healthy living and healthy lifestyles. And so doing more, as we said earlier, physical activity, giving alternatives for birthday celebrations even with parents. We encourage them, instead of doing cake and ice cream, let's figure out another way to celebrate our young people as they celebrate another year of living. And then, of course, involving the community in this. So our walking groups and even with the Learning Center, we're not just focused on the Trinity Church members, but on the entire Southwest Atlanta community.
And I can tell by your reaction that it's been positive so far. How has your congregation taken it?
Oh my goodness, they love it. The congregation loves it. The community loves it. It allows us a face in our community in a very intentional yet healthy way. So it's almost like doing two things at one time, you know, because we're really promoting healthy living, promoting healthy lifestyles, but not just among the church members, but in the community. And then, of course, that gives us a face in the community. And so there are individuals who want to walk. There are individuals who want to live healthier, but they don't want to do it by themselves. And so now they have a face of a safe space of a group of individuals focused from our church who are walking in the community anyway. And so now they know, hey, meet up at Trinity at a certain time, and you've got some people that can walk with you, talk with you, encourage you, and also promote healthy living.
So you've pumped it up so much. How can other churches be involved?
Oh, it's so easy to become involved with the work. So if you would like to be involved, we just encourage your wellness or your health and wellness ministry leader to contact my office at 404-612-9467. Again, that's 404-612-9467. And we'll be more than happy to schedule an appointment to come out and speak with you one-on-one about our program offers and how to get started.
All right, awesome. Well, thank you so much for sharing your message. I appreciate it.
Thank you.
Absolutely. Thanks for having us.
All right, well, when we come back, have you heard about third-hand smoking and how it can impact your health? Well, we will explain that and more when the Department of Public Health's Director of Chronic Disease Prevention joins me after the break. Stay with us. Welcome back to Healthy Living. I'm Priscilla Ortega. Today's episode is all about heart health. Joining me now is the Director of Chronic Disease Prevention for the Georgia Department of Public Health, Dr. Jean O'Connor. Welcome to Healthy Living.
Thanks. Glad to be here.
So first of all, are the rates of heart disease, are they going up? Are they going down?
Well, the rates of heart disease here in Georgia are actually falling, and that's true across the country. But that's not because people are necessarily eating better or getting more physical activity. That's because we're getting better at care for heart disease.
So it's not necessarily residents in general that are doing a better job, it's doctors, procedures and stuff.
Yes, it is those kinds of things. And here in Georgia, we actually have a rate of heart disease higher than the national average, especially for our Black or African American residents of our state. It's significantly higher than what we see nationally here in Georgia.
So let's talk about risk factors. What are some risk factors for heart disease?
Well, the major risk factors for heart disease are things like overweight and obesity, lack of physical activity, poor nutrition. If you have diabetes or prediabetes, that also increases your risk of heart disease in the long term. High cholesterol, high blood pressure, all of those things put you at risk for a heart attack or heart disease.
And smoking is also a major risk factor. Why is that?
Yeah, smoking is actually one of the most significant risk factors for heart disease. It's actually exposure to secondhand smoke as well that puts people at risk for heart disease or heart attack. So exposure to secondhand smoke or smoking directly are, neither is good for you. Smoking increases, it makes your blood vessels constrict, and it increases the stickiness of your platelets in your blood. Those two things together increase the likelihood that you may have coronary artery disease, that plaque will build up over time, and that you may eventually have a heart attack.
So something that's kind of, been around and it's increasing in popularity are e-cigarettes, and I think some people think, oh, well, this isn't smoking, this is just an e-cigarette. What are your thoughts on that?
So it's not just the tobacco, it's actually nicotine that causes that plaque to build up in your arteries over time. And e-cigarettes certainly do contain nicotine, so they are dangerous as well from a heart disease standpoint for all people.
And, when they say it's vapor that's coming out, is that dangerous? Can you get secondhand smoke from e-cigarettes?
You can actually. So many people do think that vapor is just water, but what we know now and what the Surgeon General has reported very recently is that e-cigarette vapor contains many chemicals. It does contain nicotine as well. And that's why people like to use e-cigarettes. And those chemicals can be dangerous. They're particularly dangerous for children and for pregnant women. And so we really do not recommend their use.
Now, something I haven't really heard too much about is third-hand smoke. What is third-hand smoke exactly?
So if you've ever been around someone who's used a tobacco product, smoked a cigarette, you've smelled that sort of smell that you often associate with cigarettes. It can be in the hair, it can be on clothes, it can be in a car or in a home, in furniture. That's what we refer to as third-hand smoke. And what many people don't know is that is dangerous as well. It can be toxic for children and for pets. The chemicals from the cigarettes can linger, combine with other indoor air pollutants in a home, and make these particles that are really what we call ultrafine, that are particularly dangerous as well in ways that even the cigarette smoke itself may not be.
So let's talk about smoke-free policies and how is that impacting cardiovascular health, or is it impacting?
Yeah, so smoke-free policies can be a terrific thing to reduce the rates of heart attacks in communities. So the research shows that there can be anywhere between a 6 and a 47% reduction in heart attacks in a community in a relatively short period of time after a smoke-free air policy is passed. And we've seen examples of this all across the country and the world. So smoke-free policies at a community level can be a terrific thing. They also can help to protect workers, people who may be exposed to secondhand smoke in their jobs, from those negative health effects of being exposed to tobacco.
So the goal is to get everyone to quit smoking. How can we help?
Yeah, so for many people who use tobacco products, of course, they are addicted, and so being around tobacco products and using tobacco products, it can be hard to quit. The Georgia Tobacco Quit Line is a tool that we refer people to. The phone number for that is 1-877-270-STOP. It's available in English and Spanish and a number of other languages. It's also available for the hearing impaired. And you can access it 24 hours a day, 7 days a week to get help
And
with
what
quitting.
sort of resources do they get if they call this Quit Line?
So someone who calls the Quit Line is going to get an opportunity to talk with a quit coach if they're ready to quit. They can get a 4-call series for pregnant and postpartum women. There's a 10-call series. They're also going to get 4 weeks of nicotine replacement therapy for free. So the Quit Line is totally free. It's confidential, and it's available for anyone in Georgia the age 13 or up.
Great. So call the Quit Line.
Call the Quit Line.
All right. Well, thank you so much for all the great information. I appreciate you being here.
Thank you.
All right. We will be right back with a quick wrap-up. Stay with us. We hope this discussion on heart health has been helpful to you. Remember, you can get more information about quitting smoking by calling the Georgia Tobacco Quit Line at 1-877-270-STOP. That's 1-877-270-7867. Or you can contact Pitch about their PE teacher or daycare health training programs at 404-612-3492. Thank you for watching. We'll see you next time on Healthy Living.